normal back pain, or slipped disc?
Most people will attribute back pain to muscle strain. And massages works very well for muscle strain. Hot packs or cold packs, putting some warm ointments on it, that works well too. Or visit a physiotherapist, maybe a chiropractor. And typically after 1 or 2 sessions with them, the symptoms tend to go away. Now, if symptoms do not go away, they remain persistent and they get worsened from day to day, and you have pain that travels down from your back or from your neck down to your arm or to your legs, then I think you have to accept the fact that this condition, it is definitely not a simple muscle strain, and therefore treatment needs to be sought after. When you have slipped discs of the back, one of the typical symptoms is the pain typically starts from the back. Some people will describe it as an electric shock-like quality. Some describe it as a sharp pain. Some describe it as pins and needles. And it typically spreads down one leg, spreads down to your knee or to your ankle, but it typically spreads down one leg from the back. Occasionally, these symptoms are associated with numbness. Patients will complain that their toes are numb, or the sole of their feet are numb, or the side of their legs are numb. If the condition is left to progress, this numbness will then progress into weakness, and they're not able to lift their toe, or they're not able to lift their foot. When they wear sleepers, the sleepers just go flying off. They're not able to hold their sleepers. They find themselves always tripping because the leg is not able to clear the ground when they walk. These symptoms suggest that there is nerve impingement, nerve compression, and potential early nerve damage secondary to slipped disc. Something quite similar to this. When the nerve is already impinged, the first sign of nerve impingement is pain. So that's when you get pain spreading down your leg. As the compression gets worse and worse, then you start developing numbness. That will be the second stage, or second sign that condition is getting a little bit more serious. And the final stage is when you actually have weakness. Weakness refers to the fact that the nerve is potentially damaged. And this weakness will be very obvious when we try to walk. The toe is weak, you can't lift your toe, you can't lift your leg, you can't lift your foot. You're constantly tripping. So that tells us that the slipped disc has progressed and treatment is needed urgently for such conditions. Similarly, if it occurs in the neck, you'll find that you have pain traveling down from your neck to your hand. And then eventually you realize that if you leave it long enough, it progresses to numbness. You'll find that your fingers are numb. When you hold a pen, when you try to hold a glass, it's numb. You cannot differentiate cold water from warm water. Leave it long enough, then you progress to weakness. You find that you can't lift a pen, you can't hold a plate, you're not able to hold spoon or chopsticks, your writing is not the same as before, it becomes a bit smaller. So those are signs of weakness. One of the typical signs that we see in the hand that there's weakness is when you see your one hand is smaller than the other hand. The muscles in the hand appear to be slightly smaller when you compare it to the other hand. So that's a sign that you had slipped disc, pain that progressed to numbness, and subsequently weakness with potential nerve damage that is occurring in your hands.